We, as a whole state, we're getting graded on our social distancing. We're not doing very well.
A warning from local health officials tops our news tonight. They're making sure you don't lighten up on the fight against COVID-19. Good evening to you and thank you for joining us. Indiana is nearing its projected peak of COVID-19 cases. Officials say it could happen within the next 10 days.
But one Vigo County health leader is speaking out tonight. He's saying we're much more than 10 days away from the end of this. News 10's Sarah Lehman is live in our newsroom. She talked with Vigo County Health Commissioner Dr. Darren Brucken. She has more on what could still be a long road ahead.
Patrice Rodrell, health officials are saying right now is an extremely important time to keep doing what you're doing. That means staying at home, social distancing, and wearing masks and gloves when you're in public. As we watch other states and countries fight the battle of COVID-19, many of us wonder, when will we get back to normalcy?
And the question is when? Everybody wants to know.
Dr. Darren Brucken, the Vigo County Health Commissioner, says we should not be looking at a certain date for that. He says the time is fluid because
if we pull the plug on it too soon or get lax too soon, we're just going to have more people get sick and more people die, than what we're already going to have.
He says health officials have been watching China for what they should and should not do.
China took their foot off the gas a little bit and they immediately had a spike. They made some mistakes, and the rest of the world saw that.
Brucken says we may see other states reaching their peaks, but for Indiana, right now is a critical time.
And right now is incredibly important, the next 2 weeks in particular. I know with the national news coming through saying, oh, there's light at the end of the tunnel, New York has already crested, everything is starting to come down. That means nothing for us locally. That does not mean we are through this. In fact, we are just now still approaching our own Indiana vertex. Now is the critical time where everybody has to hold the line and do their job.
And he says we need to still be diligent even after Indiana hits its peak.
We're not there yet. After that peak has been reached, we still have the illness, we still have the burden, we still have the sickness in the hospital, we still have the people on ventilators, we still have people spreading the disease in the community. And the only way to help mitigate this disease burden is for people that are infected to remain infected themselves and not to spread it to others.
Now, I know all of this seems like a lot, but Dr. Brucken says if we can make it through the end of this month by social distancing and taking precautions, we may also be able to see the light at the end of the tunnel ourselves. Reporting live in the newsroom, Sarah Lehman, News 10, back to you.